Welcome back to Healthwise with our special guest, Dr. Kevin Guillory with Family Clinic in Opelousas. Doc, we were talking about diabetes and about some of the meds and stuff like that. What exactly, I mean, I know, but I want the audience to know, what are some of the medicines and what are some of the things that, that you can take?
So we'll talk about the medicines, and before we hit the insulin, there are oral medications that we can start. And like I said, it does depend on where your sugars are. If you're greater than 300 or you're ranging in 400, and if you're newly diagnosed, sometimes it's okay to at least give the oral medications a try, and maybe down the line you can be started on insulin if we're not getting the control that we would like. But a lot of the first line medications and a lot of the first medication that a lot of doctors like to start is called metformin or glucophage. And this is, it can be a simple medication, but like all medications, it has side effects. But you normally take it once or twice a day, depending on where you're at. And if that controls the sugars on its own, then great. If not, then we go to some of the older medications. There's Actos, there's glipizide, and then there's new ones like Januvia and Onglyza that work in different ways. They work some work on the liver. A lot of them work to help the body respond better to insulin, because it's, of course, like we said before, the body's not doing what it's supposed to do to insulin. So a lot of times it helps just work better, help respond to the insulin, work on the liver. But those are some of the oral medications. Now, if we get to a point where the oral medications aren't working and we have to start insulin, there's also different insulins that we can start. There's insulin that you can take once a day, like Lantus. And the way that works is hopefully you take it once and it keeps control of the sugars all day. But sometimes we go to the other insulins that you have to take once or twice a day, like Humulin. And sometimes diabetics have to take it with meals because they aren't getting the control that they need with just one shot a day. So it varies, and you just have to, it's an individual thing. You just have to talk with your doctor about what's best for you. And a lot of patients are very antsy about starting insulin, so that's why it's important to catch it early. Sure. And in the type 2 diabetics, it's important to catch it early so that you can avoid the insulin. But, if it gets to a point where it happens, then there are injections that you have to take, but there is teaching out there to kind of help you with it. And it's not as bad as you think. I mean, with the teaching, with the information that you get from the doctor, if it gets to the point where you have insulin, it's not a death sentence. A lot of patients see it that way, but it's not. So, I mean, but if that's the control you need, then that's the route we go.
Sure. And reiterating what you said, we see a lot of insulin patients all the time, and diabetics, and the worst part, very seldom when we go on an emergency call, is it because their blood sugar is too high. Most of the time with us, it's because they have taken insulin and not eaten, and they end up with low blood sugar, and we usually get to them, they're very confused, they're sleeping, we can't wake them up until we we bring their blood sugar back up. So that's the danger.
Right, that's a danger, and it's really, sometimes it's not with insulin. Some of the oral medications, if not taken correctly or if not taken with food, can lower the sugar. So it's important just to stay informed. Ask your doctor any questions that need to be asked. Call your doctor, or ask them at the appointment, so that you know what to look for when your sugars drop. Because like you said, they can get confused, real sleepy, just real tired, very weak, and that is a big danger. And especially with insulin, with oral medications too, as I said, that you can run that. So just be sure. I mean, like, running high is low. I mean, running high is a big factor, but running low is very dangerous. Right. So just stay informed.
And like I said, that's mainly what we run into, because and then we tell them, because some of them we know, we see them on a regular basis, and we tell them, oh man, we said, you know, you did it again. You know what I mean? They'll do it. They'll take insulin and won't eat, you know, or they won't take their blood sugar, which is another thing that's very important.
That's correct. That's another thing. When we diagnose diabetics, we like to say, check your sugars. And what we like to do is they get a glucometer, whether through prescription or if we have samples in the office, they get glucometers, and that's basically just a sugar monitor. And it's just a little finger stick, and you know, it has directions, and there are classes, and we also at our clinic teach them how to use it. It's just a little finger stick, and it takes a little bit of blood, and it tells you where your sugars are at. So yeah, it's very important, you know, to check your sugars. And you know, just because you're diabetic doesn't mean you have to avoid sugars altogether. It doesn't mean you have to avoid all the good stuff. Right. Just do it in portions.
Moderation.
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 Keep it under control.
Moderation. Well, great. Well, Doc, it was good to have you. We hope this is the first time you've come on our show. We hope it won't be the last. You're welcome to come anytime. I'm sure the audience enjoyed your talk about diabetes, and it's something very important that they need to know, because it's a big deal here in Louisiana, especially in this part with the foods and all the stuff we eat. Well, Doc, thanks again.
Thanks for having me.
Thanks for joining us on Healthwise, and we'll see you next week.
Healthwise is brought to you in part by Opelousas General Health System.